When women are potentially facing a mastectomy and radiation therapy, we need to take on board that we have a treatment journey that involves the surgery, possible reconstruction, and additional other therapies, which is quite a lot. And so here we can consider doing everything at the same time, making a breast with the tissue-only back flap, which does allow us to give that woman chemotherapy and radiotherapy, or we can allow women to have perhaps a staging approach that allows us to save the breast skin, put a temporary breast expander implant, allow the women then to complete all their treatment, and 12 months later to have their final tissue-based back flap. Now, both of those are well-established approaches in women facing radiation therapy and chemotherapy. And both have side effects that are very well accepted by women who face this more challenging scenario.
We normally advise people not to drive for about a month, and depending on what sort of work they do, some can be back at work within a 6-week period, others take longer because we all recover at different rates, and that very much depends on if you're having other treatments for breast cancer that you might need to have some time off work for those. The implant's inserted underneath the chest wall muscle. You would then be seen in clinic about a week after the surgery, and then you would need to actually return to clinic on a fairly regular basis to have saline inserted to the implant in order to expand it to the desired fullness that we wish to achieve.
You'll find lots more information on the recovery from your operation in the patient information sheets that will be given to you. For us, one of the most important aspects of your participation in Quest is hearing what you have to say. We want to know how tired you are, if you're in any pain, and how you are managing your daily activities. You'll be given a short booklet with simple questionnaires asking you to report on your quality of life before and after your surgery and breast reconstruction. These women were invited to a question and answer session with a surgeon to talk about their experiences and quality of life after their back flap breast reconstruction. These group sessions are not part of the Quest trial.
I'd like to ask, does the breast feel the same after a reconstruction?
Yes, Gillian, that's a lot of women's concern. Obviously, when we spare the envelope of the breast, we expect a reduction in the sensation because of the way we're dissecting under the skin of the breast.
Will I be able to keep my nipple, or is it something that will go with the...
I think, Caroline, in the majority of situations where we're recommending a mastectomy in women, it would be safer not to preserve the nipple and areolar complex because of the closeness of the tumour or perhaps the extent of microscopic cancer cells.
Can I ask, would someone expect to have normal arm function following this procedure?
The latissimus muscle, or the back flap that we use, is obviously one of many muscles that served to lift the arm upwards and to the side. Having said that, other muscles are able to compensate. The procedure is certainly not a new one. It's been around for 20 or more years. What we would say is important is early arm physiotherapy and exercises, really within 48 hours of surgery.
How long will it take to get back to normal day-to-day functions using your arm?
Many of the women have had a lymph node dissection, so there can be some tightness under the arm, but really we would expect that within a matter of weeks.
After the surgery, how much pain would anyone would have?
We accept that in any surgical procedure, patients have an individual response to pain. One of the key issues is to ensure that patients understand how to score their pain and to work collaboratively with the nursing staff to really ensure that their medication is conscientiously taken so that the pain is kept to the absolute minimum.
With the back reconstruction, is there a timescale when you get over the effects of that? Or
Yes.
Are there any adverse effects?
Okay, it's important, Rosemary, that we understand when we are doing the back flap procedures that women are individual. So that's the first point to make. Knowing that, we know that it is important to warn women that the back may feel slightly tighter if we've taken a bigger island of skin. Therefore, early stretching of the back, physiotherapy, to try and loosen up all the tissues, it makes common sense. Keeping any discomfort under control to facilitate that process. Obviously, we want to be very sure about minimizing any complications, be it fluid collections on the back or any infection if those collections are needled. So once again, we would say, as a majority, that really women should resume normal activities within 3 to 6 months, and by 6 to 8 weeks would be back at work, understanding there is an individual response.
Can the other breast be lifted?
We understand when we do reconstruction surgery that we want to achieve so much at the time that we remove the cancer. But of course, like everything, women may change their body weight, and therefore it is absolutely acceptable and part and parcel to anticipate women may need a slight lift or reduction on the other side. And that's very much driven by the patient and her feelings about the reconstruction.
Just to remind you, the Quest trial aims to find out whether it is better for you to have your reconstruction at the same time as your mastectomy, followed by your radiotherapy, or as a stage-delayed process, having your mastectomy and then your reconstruction after all your other treatments. If you're involved in Quest, you will be helping with the first groundbreaking trial in breast reconstruction, which will involve many hospitals throughout the UK. Other women have reported very positively about their experiences of participating in a clinical trial. We hope that you will feel the same way. Quest's aim is to improve the quality of life of everyone undergoing a breast reconstruction.